judgy face again.
Well, I haven't heard the song that you picked, so.
It's a secret.
I see what you're doing now.
Harley dances.
Yeah, he does.
So why that song?
Because today we're talking about diabetes.
Diabetes. The Wilfred Brimley diabetes. Diabetes. And Harley's just here for fun.
Yeah.
Just to be ridiculous. He has nothing to do with anything.
No.
He doesn't have
always
diabetes.
ridiculous.
It's okay. Ha, little friends. Yeah, what do you know about diabetes? He's like, I know nothing. What do you know about diabetes? What is it?
So, it's basically where your body doesn't produce enough insulin.
See, yeah. In people, there's two different types of diabetes. There's type 1, there's type 2. Type 1 is a straight insulin deficiency, and that's kind of basically what dogs get. Type 2 is more your body's just not making enough, and it's a subtle difference between the two. But the type 2 diabetes, that's the one where, sometimes with diet change and weight loss, you can go into remission and not have to have insulin injections, whereas the type 1, they have to have it. So type 2 is more like what cats get, where diet and weight loss can certainly make a big difference on if they're going to need insulin long term or not. So that's what we're talking about today. It's called diabetes mellitus is the full term for it. There is another type of diabetes called diabetes insipidus, which is completely different. But today, like I said, it's the Wilfred Brimley diabetes. Do you know who Wilfred Brimley is?
Yeah, the guy from the commercial.
Oh, thank God. I was worried. The oatmeal guy, right? Is he still alive?
I don't know.
I don't know. I hope so.
He's
I
really
hope so.
funny.
He is. He's great. So diabetes mellitus. So we have a few patients that are diabetic.
Mm-hmm.
One was diagnosed recently. Others have been managed either, elsewhere, and now they come to see us, or maybe we started them on insulin and managed them long term. So
You had a cat.
I had a diabetic cat. Yeah, actually, that's why I ended up with him. He was 11 years old. It was a client that I diagnosed diabetes in this cat. He'd been peeing all over her house. So that's one of the clinical signs of diabetes, one of the symptoms is increased thirst, increased urination. We also typically will see weight loss despite a excellent appetite. Their appetite's usually up, or at the very least normal, and yet they're
why is that?
dropping weight. Why is what? Why is their appetite up?
No. Why are they losing weight?
Oh, so they're losing weight. So in diabetes, so they need the insulin for their cells to be able to use the sugar that's in their blood for energy. So if you don't have insulin to take that sugar into the cells and use it as power, basically, then their bodies start breaking down other things. So fats, proteins, because it's not able to use sugar. So they'll typically eat really well because they're hungry, because they're losing weight, but that doesn't help the weight loss because they're still breaking down that fat and that muscle for energy. So that's what insulin's job is. So that's why we typically will see a high blood sugar. That means that the sugars that are floating around in the bloodstream are high because the cells aren't able to take that into them and use it as it should. In normal people and normal animals, the insulin kind of holds the hand of that little sugar molecule. It's like, hey, come on inside this cell, come to the party, and does its thing, and that's what the cell uses for energy. So when it's not there, that just means there's more free floating around in the bloodstream. So that's the job of insulin. So if we're insulin deficient or resistant, they typically, even the cats that are type 2, will typically start them on insulin. Sometimes they're a little borderline and we can get by with trying just some diet and weight loss first, but I would say the vast majority of the ones that we see, they've been diabetic for a little while, and they're showing some pretty significant clinical signs. And so we have to start them on some insulin injections, and then sometimes with that we can get them into remission. It just depends. My cat was one that, like I said, he was peeing all over the house, and so they came in, we checked some urine looking to see, you know, is it a UTI, is it a kidney issue? Turned out it was diabetes, which really is not a horrible diagnosis as long as you know what you're getting yourself into, and you're willing to treat it. There's somebody walking outside. So yeah, so we she wasn't able to keep the cat anyway for other reasons. And then there was a financial aspect there. So me being the sucker that I am, I took this 17-pound cat home, you know, to foster. We all know how that happens. Yes. Yeah. He's gonna go see. So he came home with me. We started him on insulin. We started him on a special diet that is low carbohydrate. It was Purina DM is my choice for cats. Typically, it's the one that I like the best, because research has shown that combined with Lantus insulin, also known as glargine. Oh, we're friends now. Is one of your best chances for getting them into remission. So he went on a diet. He lost 3 pounds. I put him on meals straight away. He figured it out.
Straight away, like is that like a British or straight away?
That's a normal saying.
Okay.
Is that not a normal saying?
I feel like it's
straight away. I don't know.
Exactly. I feel like it's got to be something else.
Anyway, so immediately, how about that?
There you go.
So as soon as I brought him home, I put him on meals. He was not used to that. He figured it out. So that was one good thing, is because his appetite was up. It was fairly easy for me to be like, here's your measured amount. He got a 1/4 cup of food twice a day with a measuring cup. I had a specific 1/4 cup measuring cup so I could make sure it was level every single time. So twice a day, every 12 hours, he got his food. He ate. He got his insulin. We got his blood sugar under control, and he eventually went into remission. So that was amazing. So he stayed in remission until he ended up with kidney failure. So not related, but yeah, he stayed in remission for the rest of his life. He lived another 4 or 5 years.
Yeah,
it was a while. Yeah. Yeah, he was a cool cat. He suckered me in because I picked him up and he like wrapped his little legs around me, gave me a little hug. Well, you're getting in trouble, man.
Get you.
So he suckered me in with that. So that was Gibson. That was my Gibson. So that's how we like to see things go for cats. It's not always that easy. Some of them are easier to regulate than others. Some of them are more cooperative or less cooperative for their injections or for the food change. Because cats are cats.
Yeah. Well, and a lot of it too has to do with the people too.
Yes, for sure.
You have to stick with it, and like we've talked about before, it's not an easy fix. It takes a long time.
It takes a long time. It's a lot of trial and error.
And a long time to get them regulated, because we can't say, oh, this is a 14-pound cat, you need 3 units of insulin.
Yeah.
It takes time to figure out the dose that they need.
Yes, because it's not like dosing an antibiotic. When we dose a lot of the other medications that we use, it's very simple. It's like, oh, it's this many milligrams per pound of body weight. Done. That is the dose. But with insulin, it's just kind of a starting place. And we don't like to start them too high because then we drop their blood sugar too fast. They get hypoglycemic. That can cause some really severe issues. It's something that they could actually die from if they're hypoglycemic, so low blood sugar, for even a short period of time.
Definitely worse.
Whereas, if they're just running a little bit high for an extended period of time, it's not the end of the world if we're addressing it, if they're on insulin. So we typically start them out kind of a moderate to low amount and then work our way up because everybody's dose is different. So we've seen some cats get like 2 units and they're doing great, and then other cats are on like 6. So you just trial and error, and we check blood sugars on them, and there's a couple different ways to do that. So we can use the little glucose meter, glucometer, like similar to what people do, where they do like the little finger prick and then they put it on the little strip. So we have something that's made for animals, it's calibrated for them. So if people are wanting to do blood sugars at home, that's one way to do it. That used to be the only way until fairly recently. Now they have the Freestyle Libre. So I think it's used. I think it's the exact same one that they use in people, where they have like the little probe, and people like have them on their arms or on their all different places. But on cats and dogs will use it just on the skin on their back. Shave a little area. They have that on there. It's a continuous glucose meter. I think it lasts 14 days or until the sensor falls off. Definitely with activity and that. So it's easier to keep on cats than I think it is on dogs, just because their activity levels are lesser. But yeah, it's a continuous glucose monitor, which is cool because we can get more frequent readings. They're going to be more accurate than people trying to do like the ear pricks or the paw pricks at home.
Plus
you don't have to poke them a bunch of times. Yeah, and it's just all scanned from like your phone. You just download an app on your phone, and it's got like a little meter thing, and it can all communicate. It's really cool, really, really cool. So that's a nice option. It's more expensive than the little finger prick monitor. The Alpha Track is what we recommend using, but you'll also get more accurate numbers, more numbers without having to poke them. So it's cool. It's a really cool one. And if you have a pet that's difficult to regulate, that's a really nice way to try to figure it out. So yeah. Let's see, what else do we have? So there's different types of insulin, and depending on what kind of pet you have, if you have a dog or if you have a cat, their bodies like different kinds of insulin. There's one that we use in dogs that is really inexpensive. Doesn't really do much for cats though, so it's not something that I would recommend starting with, because we could kind of go down a rabbit hole with that. No, he's just gonna stay here. It's okay. He's fine. He's all right. You could kind of go down that, and then you're trying to play with the dose and you're just putting off getting it correct and getting that blood sugar under control. And the longer that you take to get it under control, the more likely it is that you're not going to be able to get them into remission or control them well. So it's just delaying what really needs to happen. Right. So it's worth it to buy the more expensive insulin that's actually going to work for that animal, rather than being like, well, this one's $30 and this one's $100. Yes, but you're also going to spend more in rechecks and that than if you just bit the bullet. Is that a British saying?
I don't know.
Okay.
I think that one's normal.
Okay. Bought the more expensive insulin to begin with. So that's something to go over with your veterinarian, and they'll make a recommendation, and they have a good reason for what they're recommending for sure. What else about diabetes?
Well, let's just talk about basically from the start of diagnosing.
Okay. How do we diagnose it?
So we run some blood.
Mm-hmm. What are we looking for?
We're looking for their glucose in the blood.
Yeah, blood sugar.
Yeah. They can also have glucose in their urine.
Mm-hmm.
So we check that way. Why? Because they have too much. They're excreting it.
Yeah. So urine. The kidneys are responsible for keeping sugar basically in the bloodstream and not letting it into the urine. But what happens is, as the blood sugar gets so high, it reaches a certain point where the kidneys can't keep any more back. So it starts letting sugar go out into the urine. And so because of that, water follows. So that's why they typically drink a ton and pee a ton. So in that case, withholding water is dangerous because they're drinking more, because if they don't, they're going to get dehydrated, because there's sugar in the urine, it's pulling water into the urine, so it's making it more dilute. So they're peeing large volumes, and so they're trying to drink to make up for that. So if they don't, they can get dehydrated. So that's why I think we had somebody ask about that one time. They were like, well, I can just withhold the water, right? And we're like, no.
Bad idea.
Don't do that. No, that'll get corrected as we get their blood sugar under control. When we lower that number, now the kidneys can handle it, and they're like, cool, now I can keep that in the blood, it's not going into the urine, so now we're not drinking or peeing as much.
Yeah.
So as we get their blood sugar under control, that helps. Same thing with the appetite and the weight loss. As you get your blood sugar under control and your body can use the sugars the way that it's supposed to, because you're giving them insulin, great, that gets corrected as well.
Mm-hmm. So
those are the two. So just a high blood sugar is not necessarily a way to diagnose diabetes. Why not? Especially in cats.
Especially in cats, you know, if they get stressed, their blood sugar number will go up.
So, you know, come into the vet.
Stressful.
That's stressful. So just the car ride and getting here and their exam, and maybe there's a dog barking in the next room, or, you know, who knows what. So just that stress, I've seen them quite high. I've seen them in the 300-400 range, just from stress.
So normal.
So normal is going to be somewhere in, you know, I think it depends on your reference, but somewhere like 70 to 150-ish. Obviously there's some wiggle room there, but, you know, I would up to 200 is probably not anything bad. But so cats that are stressed, that blood sugar will be up. But because it's a sudden spike, we haven't had a chance for that sugar to end up into the urine yet. So especially for a cat, we need two things to diagnose diabetes. 1, elevated blood sugar. 2, sugar in the urine. If we have elevated blood sugar without sugar in the urine, we may do a little bit more looking, depending on if the cat's, you know, showing us signs that we think it might be diabetes. Or we may just be like, no, it's just stress, because they're not, you know, they're not losing weight. They're not drinking a lot or peeing a lot. You know, they're not showing any of those other symptoms. So, yeah, we might just be, yeah, that's cool. Do you know the name of the test that we could do if we thought they had diabetes, but we couldn't tell? Maybe we couldn't get urine.
The fructosamine?
Yeah. What's the difference between that and the blood glucose?
So I don't know for sure, but I think that I know.
I think you know.
So basically, doesn't that show like a range or like a median of where they have been over the past couple weeks?
Right. Yeah. So it's, you know, it's not like it gives us a range per se, but it gives us a number that is an indication of kind of where their blood sugar has been at over the past couple of weeks. So, you know, that tells us if that's elevated and maybe we weren't able to get urine because maybe their bladder was empty or something like that. So we check that fructosamine level and we're like, hey, you know, oh, they have been high, you know, over the past couple of weeks. So they probably are really diabetic. We can also use that number for our monitoring. And there's a couple different reasons we might want to do that. Again, stress of coming to the vet. Maybe we're worried that blood sugar is reading elevated when they're here, but maybe that's not real. So we may do a fructosamine at that point and see kind of what their average is. Again, that would be a time where that continuous glucose meter would be super cool. But yeah, fructosamine level will get you kind of a ballpark idea of where they've been at. So that's nice too. That's a good test to run,
yeah,
especially for cats. We do more fructosamines on cats than I think we do on dogs.
We see a lot more diabetic cats though than we do dogs.
That is true. Yes, because they're overweight. See our last video.
Yeah, that was good.
Yeah,
that was good.
Yeah. Circle it back. It all comes around. So yeah, that's our testing that we typically do. Also, a lot of diabetics are, because of the sugar in their urine, they're more prone to things like UTIs, so which can cause stones. See the video before that. Hey.
Yeah. Man, you're just on a roll.
I'm just on it today. I had my coffee. I had coffee with caffeine in it.
How many?
One.
Okay.
Just one.
Okay.
This is water, but
because she also gets dehydrated.
I also get dehydrated because of the amount of caffeine that I ingest.
Oh, if that was the case, I would be drinking water all the time.
But yeah, so they're more prone to bladder infections. So we'll typically check urine for that. Sometimes you may do urine cultures to make sure that there's no bacteria creeping in there, because things that are causing inflammation or infection can affect what their dose of insulin is going to be. It can make them insulin resistant, so that means they would need more than normal. So that's something that we might look for. Dental disease can make them insulin resistant. So depending on where you're
at, that.
Yeah. So depending on, you know, how well regulated they are, you know, maybe they've been regulated and then all of a sudden their blood sugar is crazy high, your vet may suggest getting their teeth done, addressing the dental disease that's there and getting that taken care of, because then that would then reduce their insulin need later.
Interesting.
There are some other diseases that can happen that will cause, your list popped up there.
Well, I'm just wondering if
What?
Because it said that, because we don't see any comments during our videos, but it said that it was not set.
Oh.
So I wonder if,
I don't know. Okay.
if we had to set something.
But other disease processes that will affect that Cushing's disease, which is basically where the body produces too much cortisol, so it's like being on steroids all the time. That will make an animal insulin resistant, and so some of those too, you withdraw the steroids or you take care of the Cushing's, and that will improve their blood sugar. It may actually reverse the diabetes. Being on steroids all the time, that can trigger diabetes. So that's another reason that we don't tend to do steroids long term, like prednisolone, Depo-Medrol. We try not to do those things long term unless we have a really good reason for it. And there are some diseases where we have to do steroids long term. It's just not something that happens commonly. There's usually some other option that we can switch them over to once they are regulated. So,
and if you get steroids to go home, make sure you follow the instructions. Give them until they're gone, until you're supposed to.
I feel like that's probably any medication.
Yeah, but I feel like steroids in particular.
Is a big deal. Yeah, I mean that's a big deal to follow directions exactly, because that can really mess up your pet if you don't.
Yeah,
that can be big bad stuff. It can end them up in the hospital. So not good.
So we diagnose.
Yep. So you diagnose. We treat.
Then we will treat them.
Yeah.
So you'll put them on insulin.
Insulin for sure.
Usually we have you come in and the pet stays here for the day.
Mm-hmm.
Most of the time with their first injections, we'll do the curve, which is where they're getting insulin in the morning when they get here. So we test their blood sugar, give them their insulin. We want them to eat first before they get insulin.
Mm-hmm.
Then we'll do their first dose and check them every 2 hours.
Yeah.
And the reason for that, you want me to keep going?
You keep going.
So the reason for that is we want to make sure that since we're introducing insulin to them for the first time that we are giving it, we want to make sure that they're not getting too low. And like Dr. Hogan talked about, it's more dangerous for them to get too low than it is for them to be a little bit too high. That's why we want them to stay here with us for the day so that we can monitor.
Mm-hmm.
And then every 2 hours we check them. Why is it every 2 hours? Emoji.
Yeah, so there's some weird things that can happen with the blood sugar. One is if, as they're approaching getting too low, their bodies have the capability of basically releasing more sugar. So it's called smogy. So as they get too low, the body releases more sugar, and so now we go back up. And so if you just checked, here and over here, and you didn't see that dip, you think, oh, they're getting too high. We need to increase their insulin. And so then you increase it, and then maybe the next time their body can't compensate correctly, and now you've dropped them too low and they get hypoglycemic. So we check, multiple numbers if we can, trying to eliminate that as a possibility, because you just keep creeping up that dose up, you're potentially going to drop their blood sugar too low. So that's dangerous. So yeah, we're trying to catch if that's going to be a thing that happens, or if we're suspecting that that's a thing that's happening. We may do a curve as well.
Yeah. So we'll check them every 2 hours.
Mm-hmm.
And then we usually, even depending on their numbers, I mean, if they were ridiculously high, still a lot of times you'll go up a little bit more. But usually the first time that we give them their insulin, we keep them on that same number for at least, 2 weeks?
At least a week.
At least a week.
For most insulins, it takes about a week for it to kind of level out and give us a true picture of their blood sugar. So usually we'll wait at least a week in between any dose changes. I think technically Lantus or Glargine, whatever you want to call it, I think you can kind of do every 3 days. For that one, it's a little shorter. We still usually do a week, just in case.
Yeah.
Just in case. But
we don't want to drop them too quickly.
Yeah, exactly.
So then we'll send you home. We like to see them back in a week or two.
Mm-hmm.
And then at that point, we usually just do what we call pre and post. So we check them before we give them their insulin, and then still they have eaten beforehand.
Yeah.
We check their glucose level, give them their insulin, and then 6 hours later we check them again, just to kind of see where they're at.
Why do we do that then instead of a curve?
I guess because we know that they didn't emoji before. I don't know.
No, I mean it's really in a perfect world we would do a curve every single time. It's just cost prohibitive, and so especially if we're doing as we're sneaking up on that dose, maybe we just do pre and post, and then when we think that we're getting close, do a curve and make sure that we're not getting too low at any point during the day. So it's really more from a cost standpoint.
Yeah.
Mm-hmm.
Oh, I had something I was gonna say.
It's gone.
It was good too.
it was really good.
So tell us why we don't just do like a spot check. You're not a big fan of those.
No, a spot check's kind of pointless, honestly, because you don't know where they were at before, and so a random spot check is just not helpful. I can't adjust a dose based on a spot check. So a one-off, just show up and say, hey, let me check my animal's blood sugar. I'm like, well, we can, but other than if you were worried they were getting too low, that would be about the only time that a spot check would be at all helpful. So if you're like, oh, I'm worried that he's getting hypoglycemic, okay, yeah, a spot check. Well, then he's normal or he's high, that's fine. Then that's okay. But other than that, as far as trying to do any kind of dose adjustments, a spot check's not useful. Okay. You better, and if you can't do a curve or you can't do a pre and post, that's where a fructosamine would be useful. So at least it's not as good, but at least gets you close, gives you some kind of an idea of where their average usually is.
So let me throw this out here. I don't think we've ever talked about it, but it just popped into my head. So you said with the Lantus, you can do like 3 days.
Yes.
So what if someone wanted to do the Freestyle Libre, the monitor, and the Lantus? Yeah. You could get them regulated fairly quickly, maybe with
in theory,
with like just 2 of the little patches if they
it could be like in a month or 2, instead of some of these unfortunately get drug out for several months,
if not longer.
Yeah. Because those numbers do funky things throughout the day, and it just So that would absolutely, for a cat, that would absolutely be probably the fastest way to get them regulated. Mm-hmm. Okay. Expensive, but fastest.
Yeah. Mm-hmm. Well, and in the long run, because if we do a pre and a post, that's about $60 or $70 for a pre and a post. Yeah. The Freestyle Libre,
I think the little probe was like 90 or something like that, and I forget what the monitor was.
I want to say it was like around 200 for both pieces. Maybe it was like,
and obviously the monitor part you keep forever. You just buy the little probes whenever you need those. Yeah. He's like, I'm trying to come back over and see you, Mom.
I know. This is my life. So I feel like in the long run, that's gonna save you more money, more time, more hassle. What are you doing?
He doesn't know.
Interesting.
Yeah. Okay. And like I said, that Freestyle Libre thing, I don't think it's new to people, but it's new in its use for animals for sure. Right. I remember in vet school there was one of the pathology professors, I think it was. Clin Path instructors, he was doing research on something along those lines with cats at that point. 250 years ago when I was in school. So it's been a long time coming, is what I'm saying. Because I remember I had to do something with the probe, and we had like these cats, so we put those little like shirts, little mesh shirts on to help hold it in place. Yeah. Mm-hmm.
Interesting.
Yeah. Okay. That's cool. So there you go. Diagnose, treat. What else?
And then just monitor.
Once we get them regulated, we do still monitor them long term. It's just you don't have to do it as often. So we may what I'll tend to do is I'll gradually spread out those rechecks. So they came in and we did a curve and we're like, this is perfect. They're doing great. this is where we want to see their numbers. So at that point, I'll say, okay, let's do 1 month. Are your 1 month numbers good? Great. Let's try 3 months, and then 6 months, and then I usually try to do every 6 months, unless the client is noticing changes at home. Maybe that increased thirst and urination is coming back. Maybe they're dropping weight again. Things like that. Then we'll recheck them sooner. But yeah, every 6 months at least, because they do over time tend to need higher levels of insulin. It's like their body kind of gets used to it, basically.
Yeah.
So it's not unusual for them to need increasing levels of insulin over time, even once we get them regulated, over the course of the next few years. And that's an important thing too. Is diabetes, once they're regulated, they can go years. So it's not like, they're gonna die in 2 months no matter what we do. No, not unless there's something else going on,
Right.
that we're not aware of. I mean, I guess if they had like a tumor on their pancreas or something like that was causing the issue, then sure. But in general, our usual diabetic patients, they can go a long time.
Yeah.
What is something that happens to diabetic dogs
No.
that we don't see in diabetic cats?
Oh man.
Do you want a hint?
Yeah. Oh. So like diabetic cataracts?
Mm-hmm.
Yeah.
Yeah, so we see a lot of diabetic dogs end up with cataracts because of their diabetes. We don't really see that in cats. So there is cataract surgery that can be done. That being said, the ophthalmologist that does it wants to see their blood sugar at least decently under control, not at 700. I forget what the number was that she told me before. I want to say she said under 3, but yeah.
And they usually, when cats come in and their blood sugar is like 500, they really don't feel good.
Mm-hmm.
They feel like crap.
Yeah, they do.
Harley. We haven't talked about dose or like administering insulin at all, and like how far apart to do it.
Yeah.
You want to do that in this video?
We're at like 30 minutes.
Yeah. I
We
know.
might have to make a second video.
Okay.
It's usually every 12 hours. Like 99% of the time. We'll just leave it at that.
Okay.
Injections.
I mean, maybe next time we can show them how to
We
do
can
it.
show one. Yeah, exactly. I figure we could
Maybe
do
we'll
one on
plug you.
how to test the blood sugar, how to administer insulin. Good night, friends.
This is just one of my 4.
He's happy now though. That's what his goal was to get to
Yeah.
you. So we'll do another video because we were talking earlier and it was like, it would probably be helpful too for our clients, for the ones that have new diabetics, to have something to reference back to. Because we do the demo here. We try to make sure that you poke your animal before you leave this hospital, because you need to get over that initial like, I gotta poke him with a needle.
Yeah.
And just make sure you're comfortable with drawing up the insulin, administering it correctly before we let you go home with it.
And it's such a small needle.
It
Most
is.
of the time,
Oh,
they don't even notice.
most of the time they don't notice or care.
Yeah,
they
it's
do.
tiny.
They do fine. It's more us getting all like anxious about it. The clients getting anxious about it because they're like, oh god, it's a needle.
Yeah.
But most of the time they don't care. It's teeny tiny. It's
Yeah.
smaller than what we use for vaccines. So by a lot.
Yeah. I mean,
By
he's
a
actually
lot.
here today to earn his keep
Mm-hmm.
on one of our
Do some training.
yeah.
Do some practice. Yes.
Someone's gonna learn how to do a couple things today, so
And if
he
you
gets
hear
to
my
earn his keep.
if you hear my fool barking in the background there, he's getting his pro hard and he's gonna earn his keep too.
Yeah.
He's also gonna get his nails done
Yeah.
because they were ridiculous. But anything else that we need to talk about for it today? No. I think this was informative. I thought it was long
Yeah.
but informative.
Yeah.
Diabetes is a big topic for sure.
It is.
It's a lot of knowledge. A lot of knowledge bombs being dropped up in
I
here.
mean, there's a lot of stuff still that like it's very difficult to wrap your head around,
Mhm.
and it's hard to understand some of it.
Yeah.
And there's so much that diabetes can cause,
Mhm.
and
Sure.
things that go along with it that
Mhm.
it is difficult.
Mhm.
Even people who, I mean, we have one diabetic patient that it's been probably close to 9 months. We're still trying to get regulated.
Oh, I don't think it's been 9 months. I think it's been like 6.
6 months. Okay.
Yeah, I think it's been like 6 months.
Because I thought we were doing him when I came back from maternity leave.
I don't remember. I don't know.
6 to 9 months.
Yeah.
You know, and he's finally doing better, but it takes a very long time.
Well, and that's why it's important to, you know, do the follow-ups as we tell you to schedule them. Because the faster that we can get this stuff done, the better.
The better they're going to feel
Yeah.
and act,
Mhm.
and
Yep.
they're going to stop peeing all over your house.
Thank goodness. Yes. Yeah, poor Gibson.
So.
He had like the biggest peas in the litter box. It was craziness. I was going through so much litter initially. So, yeah. It was good. When he got regulated, then we were good.
Yeah.
No big deal.
And they're like back to normal.
Yeah.
So,
Mm-hmm.
all right.
Harley's done. We'll be done too, buddy. Okay.
You gonna
If
smile
you
for
have
the camera?
if you have any questions about diabetes, anything about diabetes, definitely let us know, and we'll try to address it in the next video when we do. I don't know if it'll be next week, but we'll do a video at some point of administering insulin and doing a blood sugar check and all that. All the things that you would need to know for your at-home care. So until then, have a wonderful week.